Hi everyone, and thank you for joining us for Return to Play Phase 1 Team Training Practice and Activities. My name is Brittany Dion and I'm the Sports and Training Manager.
Hi, my name is John Seals. I'm the Vice President of Sports. Welcome to this training. We are so excited to put it out. We're so excited to get back to some activities. It's been a long time through this crazy time. We are currently in Phase 0 of Return to Play, which means that right now athletes and coaches cannot come together, no face-to-face. On July 20th, we are starting with Phase 1 of Return to Play. In Phase 1, the stay-at-home order is lifted, but we have a restriction of 10 or less people at any one activity. And that number 10 includes all the participants. Participants are defined as all athletes, unified partners, coaches, volunteers, family members, caregivers, staff, or others in attendance of an activity. So if they are there, you have to count them. This is just a practice training phase. It's a phase for activities. We're not actually going to be doing any area events. We're not going to be competing at this point. We're going to be training. There will be virtual programming for anybody that is not able to attend in person. The school-based activities are one exception, that if you are in a school-based activity, you will follow your school's guidelines. Brittany's going to show you a video real quick on how some of the adjustments you'll need to make to your trainings or your activities.
As a coach, you have a critical role in ensuring the safety of your participants. It is necessary to adapt some of your coaching strategies to lead safe practices under Special Olympics' new Return to Activity guidelines. Before each activity, communicate the need for high-risk individuals to participate at home, and have all participants complete the COVID-19 Participant Code of Conduct and Risk Assessment forms. Forms may be tracked in GMS if the program would like. During practice, it is important to maintain physical distancing of at least 6 feet or 2 meters between all participants. To do this, place markers on the ground to indicate what 6 feet is, and have extra volunteers to remind participants to maintain their distance. We know it is difficult, but to ensure the safety of everyone participating, there are no fist bumps, high fives, hugs, or huddles right now during this COVID-19 pandemic. You can still support your friends and teammates by cheering each other on. All participants should come to the activity with their own supplies and cannot share masks, water bottles, towels, or uniforms. All equipment will be disinfected between each use. Wear face masks throughout activities, including arrivals and departures. Do not touch the outside of the mask. Do not scratch or touch your face. Masks do not need to be worn during active exercise. However, if sneezing, coughing, or yawning without a face mask on, participants should cover their faces with a tissue or elbow, not their hands, and throw away any tissues and wash their hands immediately. Throughout the activity, use verbal and visual signs to remind participants about hygiene, standard infection prevention, physical distancing, and use of personal protective equipment, or PPE.
All right, thank you, Brittany. Special Olympics Oklahoma is complying with local, national, CDC, and WHO regulations, including for participation of individuals at high risk. Teams must be sure to comply with their local ordinance as well. Every city in Oklahoma is different. So you're going to have to know what your local ordinances are and follow them also. The Special Olympics Oklahoma Board of Directors, including a medical professional, has approved this plan to return to activities. This online training is designed to educate all participants on high-risk conditions and the risk of participation. Requirement that anyone who has symptoms must stay at home and to contact their local owned health provider if they are sick for further evaluation. Requirements for in-person gathering, including PPE, hygiene, and physical distancing. All participants will acknowledge receiving education and confirm understanding of risk and participation procedures by signing the participant risk acknowledgement form. Have COVID screening protocol in place and coaches, staff, volunteers prepared to implement prior to or upon arrival at events. More information will be presented later. Ensure that the venue is disinfected or sanitized, especially the bathrooms. We highly recommend the use of outdoor, well-ventilated facilities. Where possible, instruct participants to use a single entry point to allow for the screening process and a separate exit. No shared supplies whatsoever, such as towels, water, beverages. We're not going to have the big water jug, that everyone drinks out of. Minimize shared equipment. Equipment should never be used by one participant and then another without disinfection between the uses. If equipment needs to be used by multiple people during the activity, prepare a cleaning protocol and supplies to disinfect equipment between the uses. Have hand sanitizer, hand washing facilities available at the venue. Remind participants to bring their own PPE and, if needed, their own water bottle, towel, and equipment. Have face masks, PPE available for those who are unable to bring their own. Request that parents or caregivers help provide your team with that equipment. A lot of people can help you if you'll go out and ask. Know how to communicate potential cases to your local health authorities for testing and to the Special Olympics Oklahoma office. Remind participants that during transport to activities, it is recommended that participants should wear a mask if on public transport, such as a bus, or if carpooling, which includes someone not living with them. If Special Olympics is providing the transportation, participants must wear their face masks during the travel. On arrival, conduct screening for all participants. The screening and tracking protocol will be gone over in just a little bit, but that's something that you're going to have to do every single time you meet. All participants with symptoms, a history of a recent last 14 days, COVID exposure, or temperature of 100.4 must not proceed to the activity. Continue to provide a safe participation option for those who are at high risk, thus unable to participate in person. Brittany will go over some virtual things that we have going on a little bit later that you can look at. Activities must comply with distancing guidelines at all times. No activities that involve direct or indirect contact through a ball in the hand can occur. Consider spacing for drills using visual guides such as tape, chalk, cones, or anything else that you can use to distance your athletes. Maintain physical distancing and avoid close contact. No fist bumps, high fives, hugs, huddles during or after the activity. We're not going to be touching anymore. It's a different time. Wear a face mask throughout the activity except during the act of exercise, including upon arrival and departure. Coaches and volunteers should minimize changes in personnel. Groups should stay together and not change. If you've got one group practicing in one venue and another group practicing in another venue, you can't bring them together. You can't switch them out in the middle of it. You need to stay in that group. Coaches must provide reminders to participants on standard infection prevention measures. Frequent hand washing, avoiding touching your face, cover your mouth when sneezing or coughing, and you got to do it throughout the event. No spectators should be allowed to congregate on the sidelines of activities. Individuals providing transportation for participants should remain in vehicles or at a good distance from the group until the sessions are over. If participants need assistance, caregivers may remain provided they also maintain distancing, hygiene, and use of the PPE, including the mask. The caregiver will be counted as one of your 10 people. Teams must complete the screening and tracking form for every team event. This will allow for contact tracing should a participant be later diagnosed as having COVID-19 throughout or during that activity. In Oklahoma, these are the sports that we have chosen that are considered low risk. And these are sports that can be done with social distancing or individually with no sharing of equipment or the ability to clean the equipment between use by competitors for athletics. And remember, these are just trainings. These are not competitions. So in athletics, we're looking at walking events, running events, and wheelchair events. If they will share no equipment, we're not doing any field events. We're not doing a relay where we're handing off baton. This is training in those events. For bocce, we're doing singles bocce only. but it's not singles competition. It is one single person throwing a polina and rolling the bocce balls. They pick them up themselves. We're not going to be sharing anything there. We feel that equestrian could be done safely. Most of our equestrian teams come through therapeutic riding schools who have started riding again with just 1 or 2 people present. We believe you can do that as long as you sanitize all the equipment in between uses. Golf we consider very safe. I know here in Oklahoma, most of the golf courses are open, and as long as there's no sharing of equipment, you can do that. In the next week or so, we will be putting up a training for soccer skills, something that we haven't done in Oklahoma before. That will be something that you as a coach can do. We believe would be pretty safe to do. We also believe swimming can be done safely as long as you use social distancing and put a couple lanes between your swimmers. Okay, Brittany's going to show you a video real quick on preparing the venue for your trainings.
Preparing the venue to safely welcome Special Olympics participants is vital for return to activity for phases 1 and 2. Arrive early to prepare the space. Start by ensuring the venue is disinfected or sanitized, especially the bathrooms and other high-touch areas. Wear disposable gloves for all tasks in the cleaning process, including the handling of trash. After sanitizing the space, set up signage that reinforces proper hygiene procedures, physical distancing, and wearing personal protective equipment, or PPE. Post signs in easy-to-understand language with visual cues in highly visible locations, like entrances and restrooms. The signs should describe how to stop the spread of germs by properly washing hands, following physical distancing guidelines, and explaining how to properly wear a cloth face covering. Also, make sure hand sanitizer and/or hand washing facilities or stations are available. Lastly, set up a single entry with screening and a single exit area, which means there should be one entrance into the venue and one exit out of the venue that allows participants to be at least 2 meters or 6 feet apart.
All right, how do we make this work? We realize that many teams have more than 10 athletes unified partners on their roster. So you're going to have to break out the teams into groups that are 10 or under. So, example is 9 athletes and 1 coach or assistant coach. Most teams have multiple assistant coaches. Athletes and unified partners participating in team trainings, practices, activities must have current registration, medical release on file. Nothing's changed in that respect. Everybody participating has to have that. Unified teams can also recruit unified partners to act as an assistant coach. Any volunteer involved as a return to play participant must be a category A volunteer. Brittany's going to take you through and show you how to find a lot of those documents and go through a lot of the documents that you'll be using. Brittany?
Yes, so whenever you have that, whenever you fill out your screening and tracking template, it'll be called the event leader. So whoever that is will need to at least be a Class A volunteer. And then you will take them to our website, get involved, become a volunteer. If you scroll down, you will see a Class A volunteer list. If you ever have a question to think if a unified partner or family member is in fact on our Class A volunteer list, you can always check there. Otherwise, if their name is not there, they have 3 simple steps that they can all complete online. So it's the Class A volunteer application, the protective behavior course, and the background check. As we get into forms, we have the COVID Code of Conduct and Risk Assessment form. This is a form that every single individual that is participating in a training, practice, or activity will need to complete before ever participating in the actual training, practice, or activity. So if you go to Coach's Corner, Coaches Training and Education, there will be a Return to Play button. You will click that and it will bring you to this page. You have printable resources, forms and procedures, and additional resources. Under the forms and procedures, you will see the COVID Participant Code of Conduct and Risk Assessment form. You will then go in. You will have a form, a procedures, and information. You'll need to go into the procedures to check and see how do you submit that to us. There's 2 ways. You can complete it online, or you can print it out and then complete it by hand. These forms will be turned in just like medical forms. So if you complete it online, you can complete it on the computer, and I will show you here in a little bit how to do that. But you will then name it as you save it to your laptop or computer, area number, last name, first name, middle initial, birth, month, day, and year. Then you will then go to email us at covid@sook.org, putting in the subject line and the body email. If you do print it off to complete by hand, you will then have to scan them each individually, one by one. So 17 participants is 17 separate scans, just like the medical forms, including their area number, last name, first name, middle initial, birth month, day, and year. And then you will email it again to covid@sook.org. So to get to the form, you will click Form. You will start filling it. You have who is at higher risk of COVID-19. You will need to read this before you start filling out this form. So you must read and then click each statement. So if you're filling it out online, you can just go ahead and start clicking. As you read and go through them, you will make sure that you click every single statement to make sure that you understand it. If you are a parent or guardian that is filling this out for your athlete, then I would read this to them and make sure that they understand it. You know, just read it to them, let them know that they have heard it and everything like that. So then as you scroll down, you will then do the participant full name, phone number, email, click which one applies to whoever is filling this out. The participant is either an athlete, unified partner, coach, team volunteer, staff caregiver, or parent guardian. Filling this out online, if you are the participant signature is 18 years or older, you can then just go ahead and click in here and start signing. And then you put the date. If the participant signed it, you put an X through the parent guardian signature. Put the date, print the name of the person that signed it, and then the relationship. So if the participant signed it, they put self. If the parent or guardian is signing, then on the participant signature, you will put an X. On the parent guardian signature, you will then put in the signature, date, print name, type in the name of the person that signed it, and then the relationship. So mom, dad, uncle, anybody that is, caregiver, guardian, whoever it is. After you get done, whether you're filling it out or printing it out by hand, you will then click Save, Download, Print Form. On the right, you will see 3 little figures. It's refresh, download, and print. You will click Download if you filled this out online and save it as the procedures told you to, and then email it in. If you're printing it off, just click the print and print off the forms as much as needed for people to then fill in by hand and then submit. We also have the high risk sheet that will be available. And that is just an overview of who in fact is high risk. So people over 65 who live in nursing homes, licensed long-term care facilities, people with underlying conditions as far as heart conditions, lung disease, heart failure, obesity, diabetes, chronic kidney disease, dementia. And one of the most important things that we want to put out there is that if participants are at a high risk, they may be putting themselves at risk when returning to activities with Special Olympics. But they may also put high-risk family members, friends, and teammates at high risk. And if you have individuals like that, then they may not want to return to Special Olympics in-person activities until phase 3. Later on, we will be going over virtual resources that you can do until then.
All right, now we're going to talk about the personal protective equipment, supplies for training, practice, and activities. Each individual should have a mask, cloth masks are acceptable, a small bottle of hand sanitizer, a drying towel, and a water bottle. Supplies needed for the team training are a touchless thermometer, gloves that you wear in order to sanitize, sanitizing wipes to clean shared equipment, a large bottle of hand sanitizer, extra mask, COVID signage to post at venue, tape to put up signage, pins, COVID screening and tracking forms on a clipboard to be completed before training starts. And Brittany's going to go over where to find all of this in just a second. Coach will collect forms, then scan and email to Sook after each training per instructions. Equipment as required for the sport. If sports equipment is shared, it has to be sanitized between uses every single time. Brittany's going to show you a video on traveling to activity.
So where we have the PPE resources is on our webpage under additional resources, PPE resources. And then you'll click in there. We have local businesses from Walgreens, Walmart, CVS pharmacies to online, ihealthlabs.com, kennyproducts.com. So we have help. And coaches, remember, you can always ask your parents for help in getting PPE. Tell them that you have trainings and practices, and these are required by Special Olympics. So you can always ask for help. Here's where you'll find the signage, what we're talking about right now with the return to activities protocol and everything like that. So we do have the screening and tracking template with the video of traveling to activity.
In order to safely return to activity, Special Olympics recommends that participants wear a mask if on public transport, such as a bus, trolley, subway, or if carpooling with someone not living with them. If Special Olympics is providing transportation, face masks during travel and maintaining physical distance are required. Prior to entering any activity, practice, event, or gathering, all athletes, coaches, unified partners, volunteers, family members, and caregivers must participate in an on-site screening. It is important to take the necessary steps to create a safe on-site screening area. 1. Create a single point of entry. One entryway that allows participants to enter one at a time. Remember, we strongly advise outdoor spaces only in Phase 1. 2. Use chalk, tape, cones, or other markers to indicate what 6 feet or 2 meters looks like for physical distancing. 3. Make sure you have all the necessary supplies for a proper screening, which include temporal thermometer, pens, masks, gloves, disinfectant wipes or spray, hand sanitizer, COVID-19 participant code of conduct and risk assessment forms. Volunteers will fill out a monitoring form for each participant that passes through screening. The form includes the participant's name, contact info, temperature, answers to screening questions, and the outcome of the screening. For instance, can they participate or have they been isolated and sent home? Next, you will ask each participant the following required screening questions. We recommend using visual aids when asking the questions. 1. In the last 14 days, have you had contact with someone who has been sick with COVID-19? 2. Have you had a fever in the last week? Temperature of 100.4 degrees Fahrenheit, 37.8 degrees Celsius, or higher? 3. Do you have a cough and/or difficulty breathing? 4. Do you have any other signs or new symptoms of COVID-19? Fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea?
In the past 14 days, have you had contact with someone who has been sick with COVID?
Yes.
Yes, you have? Okay, so I'm gonna actually have you step down here.
If a participant answers yes to any questions, they must be isolated from the group, sent home, and instructed to contact their healthcare provider. Participants who are found to have COVID-19 symptoms must wait 7 days after symptoms resolve to return to activity, or must provide written proof of physician clearance to Special Olympics to return to activities. Participants who test positive or have COVID-19 must provide written medical clearance before returning to sport and fitness activities. After answering the screening questions, you will conduct on-site measurement of participants' temperatures using a thermometer, preferably a non-touch thermal scanning one if possible. If a thermometer is not available, you must ask participants to self-monitor and provide results of that monitoring. If there are any concerns about fever, temperature of 100.4 degrees Fahrenheit, 37.8 degrees Celsius or higher, the participant should not be allowed to remain on site. If high, you may retest the participant after 5 minutes to ensure temperature is accurate. Record all names, results, and contact information using the template provided, and keep in case needed for contact tracing or reporting.
Okay, so for your screening and tracking template, you will then go to our page, scroll down to the training and tracking report. When you are in here, it has the screening questions that you can gladly print off and have there. So that is a resource that you have. You will then need to follow the procedure. So after every training or practice or activity, you will then need to take those 1 or 2 pages, scan them in, and email them to sports@sook.org with the subject line, the first and last name of the coach, and then screening. So the form itself, you will have the event leader, who is you or an assigned parent, unified partner, and then you'll have the date of event, practice, location, name of event. The first line is you. Whoever is the event leader, that is your name, putting your participant type, phone number. The code of conduct is the COVID code of conduct. You will put a check mark there, and I would treat it just like a medical form as far as keep a copy to know for sure that they have done this. So it'll need to be submitted into us, but make sure you have a copy so you know that they have filled that out. The screening, yes or no, is those 4 questions and taking the temperature. Sign yes or no for the symptoms. If they do have it, then you will need to put them aside and tell them that they cannot come back for at least 7 days. So if they have symptoms, it's 7 days. If they end up going and getting a test, it needs to be 14 days. And then they'll need to, if it is yes, they wait 14 days and they will have to have clearance from their physician or doctor and have that to show that they can come back. So that is for that. And this will have to be for every single participant, 10 or below. So all 10 people will need to be on this and then turn it into us. For high-risk athletes, the virtual opportunities that we have for them is on our website as well. It has past events of summer games, so Got Talent. It has things like Stay Fit at Home, soccer at home exercises, turbo jab at home exercises. It also has workout Wednesdays, and so every Wednesday we get athletes together on a Zoom call and do workouts. We had ORU basketball team this past week, and it was just great. The athletes love it. They enjoy getting to work out with one another. We also have mouth-watering Mondays. When you click in there, you can actually volunteer. So you can have, you know, a coach, a athlete, unified partner, anybody can go in here, fill out this form and put, you know, a recipe and what they're making and get in on our Zoom call for Mouthwatering Monday. So there's virtual opportunities. We will always be posting more to get our high-risk athletes involved.
Okay, if you have any questions at all, you can contact me, john@sook.org, Terry Hockett at terry@sook.org, or Brittany Dion at brittany@sook.org. Coaches, we would really like to thank you for taking the time to go through this class. We have a test that you need to take in order to receive credit for the class. It's called the Return to Play test, and you'll find it below the video here on the website. And there's also a Return to Play survey that we would really like for every coach to complete if you haven't done so already. Thank you once again for giving all of your dedication and so much time to Special Olympics. Thank you.